Are you or your patients living with the challenges of recurrent respiratory papillomatosis, or RRP? For years, managing this rare, life-threatening condition has been a continuous battle. Today, we stand at the precipice of a new era in RRP treatment with the introduction of Papzimeos, a groundbreaking immunotherapy. Papzimeos, generically known as zopapogene imadenovec-drba, is a novel suspension for subcutaneous injection. It is specifically designed to treat recurrent respiratory papillomatosis in adults. This innovative therapy represents a significant advancement in managing a complex disease. RRP is a rare and serious infection caused by human papillomavirus, HPV, types 6 and 11. It manifests as growths in the respiratory tract, leading to severe symptoms. These can include debilitating voice problems, life-threatening airway obstruction, and even pneumonia. Papzimeos is administered via subcutaneous injection, with a regimen of 4 doses over a 12-week interval. This structured approach aims to provide consistent therapeutic benefit. It is the first non-replicating adenoviral vector-based immunotherapy of its kind to be developed for RRP. This therapy works by utilizing selected parts of HPV-6 and HPV-11 proteins as a fusion antigen. This unique mechanism trains the patient's immune system to recognize and effectively attack cells infected with these specific viruses. It's a targeted approach to a persistent viral challenge. Papzimeos gained FDA approval on August 14, 2025, marking a pivotal moment for RRP patients. This approval was supported by robust clinical data from the PRGN 2012-201 trial, NCT 04724980. The trial demonstrated remarkable efficacy in participants. Specifically, 51%, 18 out of 35, of study participants achieved a complete response. This meant no surgeries were needed for 12 months following treatment. Furthermore, 15 participants maintained this response for an impressive 24 months, highlighting the therapy's sustained benefit. Recurrent respiratory papillomatosis is characterized by the growth of benign tumors, or papillomas, in the respiratory tract. These growths can occur anywhere from the nose and mouth down to the lungs. The most common sites are the larynx and vocal cords. The recurrent nature of these papillomas often necessitates repeated surgical interventions. Each surgery carries risks and can lead to scarring, further impacting voice quality and airway function. RRP significantly impacts a patient's quality of life. Beyond voice changes and breathing difficulties, severe cases can lead to complete airway obstruction. This is a medical emergency requiring immediate intervention. Chronic RRP can also increase the risk of developing pneumonia due to compromised lung function. The underlying cause, HPV types 6 and 11, makes RRP a persistent challenge. Traditional treatments focus on surgical removal of the papillomas. Papzimeos offers a new paradigm by targeting the viral infection itself, aiming for a more durable response. Papzimeos represents a significant leap forward in RRP treatment due to its unique mechanism of action. It is an immunotherapy, meaning it harnesses the body's own immune system to fight the disease. This is distinct from traditional surgical approaches. The therapy uses a non-replicating adenoviral vector. This vector acts as a delivery system, introducing specific HPV proteins into the body. These proteins are presented to the immune system as a fusion antigen. This fusion antigen then trains the immune cells, particularly T cells, to recognize and target cells infected with HPV 6 and 11. Essentially, Papzimeos teaches the immune system to identify and eliminate the source of the papillomas. This targeted immune response aims to reduce the recurrence of growths. By stimulating a specific antiviral immune response, Papzimeos offers the potential for long-term control of RRP. This approach could significantly reduce the need for repeated surgeries. It represents a paradigm shift from symptom management to disease modification. Papzimeos is administered by a healthcare professional via subcutaneous injection. The preferred injection sites are the outer, upper arm or the outer, upper thigh. Proper technique is crucial for effective delivery. Before administering Papzimeos, your healthcare provider will perform surgical debulking. This procedure involves removing as much of the visible papilloma as possible. This initial debulking helps optimize the effectiveness of the immunotherapy. Surgical debulking may be repeated before the third and fourth Papzimeos treatments if deemed necessary. This ensures that the viral load is minimized, allowing the immune system to work more efficiently. It's a combined approach for optimal outcomes. Following the injection, it is important to avoid direct contact with the injection site for at least 24 hours. This includes touching or scratching the area. Dressings should also remain undisturbed during this period to ensure proper absorption and minimize irritation. Any material associated with the Papzimeos injection should be treated as contaminated. This includes the needle, syringe, and any dressings used during the procedure. These items require careful handling to prevent potential exposure. Contaminated materials should be placed in a sealable bag and disposed of in regular trash. These precautions should be followed for 1 to 2 weeks after the injection. This ensures safety for both patients and caregivers. Caregivers should practice proper hand hygiene, such as thorough hand washing. This is especially important when coming into direct contact with a patient's body waste. Adhering to these guidelines is vital for infection control. The recommended dose of Papzimeos for recurrent respiratory papillomatosis in adults is 5 × 10⁻11 particle units, PU. This precise dose is administered subcutaneously, SC. Adherence to the specified dosage is critical for therapeutic efficacy. The treatment schedule involves 4 administrations over a 12-week interval. These doses are given at specific time points: week 0, initial dose, week 2, week 6, and week 12. This regimen is designed to build and maintain an effective immune response. Papzimeos requires specific storage conditions to maintain its stability and efficacy. It must be stored at -60 degrees Celsius -76 degrees Fahrenheit or colder. Proper cold chain management is essential from manufacturing to administration. When ready for administration, Papzimeos should be removed from the freezer and thawed immediately. Thawing can be done in a 37 degrees Celsius 98.6 degrees Fahrenheit water bath or a dry bead bath. The thawing process should continue until no visible ice crystals remain in the vial. The thawing time should be less than or equal to 5 minutes. It is crucial not to hold Papzimeos at room temperature for more than 60 minutes after thawing. Thawed Papzimeos should never be restored or refrozen. In the event of a Papzimeos spill, immediate action is required. Treat any spills with a virucidal agent, such as sodium hypochlorite with 0.5% active chlorine or 6% hydrogen peroxide. Allow the agent to act for 15 minutes to ensure decontamination. Disposal of any unused product or waste materials must follow facility biohazard waste disposal procedures. This ensures environmental safety and compliance with regulations. Proper handling protocols are paramount for this specialized therapy. Like all medications, Papzimeos can cause side effects. It is important for both patients and healthcare professionals to be aware of these. The most common side effects are generally mild to moderate. These include injection site reactions, which may present as redness, pain, or swelling at the injection site. Other common side effects are fatigue, chills, pyrexia, fever, muscle aches, myalgia, and nausea. These are typically transient. Papzimeos may also cause serious side effects, which require prompt attention. Severe injection site reactions can occur. Signs may include intense redness, pain, swelling, itching, or warmth. Your healthcare provider will monitor you for at least 30 minutes after the initial treatment. Manage symptoms with a cold compress, over-the-counter pain relievers, or antihistamines if needed. Seek urgent medical attention if symptoms worsen or are accompanied by signs of a systemic allergic reaction. These include difficulty breathing, widespread rash, or facial swelling, or if an infection is suspected. Thrombotic events, or blood clots, are another serious potential side effect. These may occur after a Papzimeos injection. Symptoms can include shortness of breath, chest pain, leg swelling, persistent abdominal pain, or neurological symptoms. Neurological symptoms may include severe or persistent headaches or blurred vision. If you develop any of these symptoms, seek urgent medical attention immediately. Early recognition and intervention are crucial for managing serious adverse events.